All right, welcome and thank you for attending today's technical assistance webinar. The webinar is presented by Amity Foundation, acting as the third-party administrator for LA County's Justice, Care, and Opportunities Department and the JCOD CFCI CARE grants. The JCOD CFCI, or Care First Community Investment Grants, are the result of ballot measure J, voted in by LA County residents in 2020. Care First Community Investment Funds are intended to be invested directly into communities and alternatives to incarceration that address negative outcomes caused by racially driven criminal legal system inequities and long-term economic disinvestment. Today's webinar is being recorded. You do not have to be on camera. Understand that if you are on camera, your image may be captured in the recording. Staying on the webinar represents your consent to being recorded. Please note the following legal disclaimer. You can also see this in the lower left-hand corner of the slide. The material presented does not constitute legal advice and is only intended to provide information. Organizations and individuals should independently verify that any information presented is appropriate or applicable to their own situation before acting on it.
So at Amity, we incorporate teachings that center the community before we begin our work. Today, we will use the LA County Land Acknowledgement to recognize the price paid by individuals that has resulted in efforts such as Care First Community Investments. We recognize that we occupy land originally and still inhabited and cared for by the Tonva, Tataviam, Serrano, Quiche, and Chumash peoples. We honor and pay respect to their elders and descendants. We acknowledge that settler colonization resulted in the genocide of the First Peoples. This acknowledgement demonstrates our responsibility and commitment to truth, healing, and reconciliation, and to elevate the stories, culture, and community of the original inhabitants of Los Angeles County. Next slide.
Today's technical assistance webinar is just an introduction to HIPAA, HIPPA, and OSHA requirements specific to nonprofits. My name is Rebecca Gray. I'm the grant administrator for Amity Foundation TPA. Mina?
And I am Mina Cabrion. I am the Training and Technical Assistance Coordinator at Amity Foundation. So we will start off with what is HIPAA? So HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA violations range from $100 per violation to upward of $50,000 per violation, with the potential for 10 years of jail time. While it's easy to assume that healthcare providers should follow HIPAA, the requirements aren't as clear for business associates, especially in the nonprofit space. So HIPAA was created in 1996, and it really has standardized the healthcare data security that's required by any organization. Next slide.
If an organization processes personal health information, so again, having worked with a few nonprofits in the case management space, some of this information is present in case files, needs to be communicated between case workers or between case managers and other organizations regarding a particular client. When this is the case, special protections are needed to protect personal health information. That's what HIPAA is all about. This obviously includes covered entities like healthcare providers, insurance companies, and healthcare clearinghouses, but it does also apply to any business associate of these organizations. Even if your nonprofit does not provide care directly, it is still required to follow HIPAA if it handles personal health information in any way. For example, if your nonprofit processes patient credit card information, it needs to follow HIPAA regulations. All right, Mina.
So 3 components to comply with for HIPAA. So you definitely want to document and share your HIPAA policies with the individuals in your organization. So your organization must document and share all internal HIPAA policies among your staff. So your employees are also required to sign the HIPAA policies acknowledging that they received them.
I'm sorry, Mina, you're reading text for slide 7. We're on slide 6. If you could just read the slide.
Yes, sorry. I'm so sorry, everyone.
No worries.
So 3 components to comply with for HIPAA. So the 3 components are the privacy rule, the security rule, and the high tech rule. So each one, so the privacy rule restricts who in your organization can access personal health information. It requires all organizations to keep this confidential and limit its access on a need-to-know basis only. Your security rules, HIPAA requires that administration, technical, and security protections for any organization that touches that PHI, that personal health information. And the high tech technology rule is the Health Information Technology for Economic and Clinical Health Act, extended HIPAA to be more compatible with modern technology. Since we're all using tech in today's world, it really has increased the severity of the HIPAA fines for any non-compliance that an organization may do.
So we do have 5 best practices for you to stay HIPAA compliant. Here are 5 things you can do now to help yourself be compliant with these rules, should you believe that they are going to apply to your work. Your organization, so the first one is document and share your HIPAA policies. Your organization must document and share all internal HIPAA policies among your staff. Your employees are also required to sign the HIPAA policies. They need to acknowledge they received them. This is essential for passing a HIPAA audit should you be audited. So make sure you save these signed documents for several years. Number 2 is secure personal health information, this PHI that you'll see peppered throughout this presentation. It is a HIPAA violation. It's your organization's HIPAA violation if hackers manage to gain unauthorized access to the data that your organization is storing. So you do have to secure data. Your employees should also be trained on how to keep personal health information secure, which means knowing they should not send emails containing patient information, even among each other, for example. Number 3, you can enable access control. Nonprofits are often small, forced to work and operate lean. However, that does not mean every employee needs unfettered access to patient data. HIPAA requires nonprofits to have access control in place. This means 1, every staff member needs to use their own account to access your network. Shared accounts aren't allowed. 2, every account needs a unique username and password. 3, you must install physical locks on paper files in server rooms. 5, restricting access to personal health information strictly on a need-to-know basis. So it's not PHI for one of your clients is not available to everybody all the time, but it is available on a need-to-know basis. Number 4 best practices is to track activity and access. It's a good idea to track how your team interacts with personal health information. Document who is accessing the personal health information and how they are using it. Over time, you can use this data to pinpoint any information that could be an undetected breach. And 5, finally, document a breach remediation plan. So breaches happen, right? People get into your data. People who should not be able to access your systems can access them. This especially happens with healthcare data, other personal files. People are always looking to grab social security numbers and things like that. While nonprofits should do everything they can to minimize breaches, it's good for you to have a plan in place for how you are going to handle a breach situation. Nina?
So let's dive into OSHA. So what is OSHA? So OSHA is their laws governing the safety at work and what is covered by the Occupational Safety and Health Administrations. We do have the OSHA.gov link there, which really dives into the laws governing occupational health and safety that's administered by the state of California. We also have the dlr.ca.gov website that is actually a free education for any employer wanting to know more about regulations pertaining to getting educated through Cal and OSHA. And that's actually offered by the Division of the Department of Industrial Relations. Next slide.
The Division of Occupational Safety and Health, DOSH, better known as Cal OSHA. And so OSHA, you can think of OSHA as the big federal umbrella. The state of California has its own rules and regulations that incorporate the federal regulations. So the Division of Occupational Safety and Health, known as Cal OSHA, protects and improves the health and safety of working men and women in California, the safety of passengers riding on elevators. So they're the people who certificate your elevator, that how many people like it can hold, how much weight it can hold, amusement rides and tramways through the following activities. They set and enforce standards. They provide outreach, education, and assistance. And again, this is free. And they issue permits, licenses, certifications, registrations, and approvals. Ms. Mina?
So, almost all workers in California are protected by Cal and OSHA regulations. So these are better known as the standards. This includes public employees and immigrant workers who are not legally authorized to work in California. So some workers, however, are not covered, are people who are self-employed, family members of farm workers who work on the family farm, federal employees. So these workers are covered by their own agencies who have to follow the federal OSHA requirements. And Cal OSHA protects California workers by making sure that employers comply with occupational safety and health regulations and keeping the workplace safe. Next slide.
So what are these Cal OSHA standards or these rules? The standards describe what employers must do to protect workers from various workplace hazards. Standards, some of Cal OSHA's specific standards cover a wide variety of workplace safety issues, including tripping and falling hazards, toxic substances, machine hazards, heat illness prevention. It's a real spotlight on that these days. Hazardous equipment, electrical hazards, hazardous waste, infectious diseases, fire and explosion hazards, trenches, confined spaces, use of respirators, specific operations, and ergonomics. So how your environment can help you perform better by providing healthy support for your body, ergonomics. Mina?
So if you want to know more about Cal and OSHA standards, you may be thinking, where can I find the list? So you can actually go to the dir.california.gov/DOSH, DOSH. And on this website, you're actually able to obtain copies of all of the Cal OSHA publications. And they go over the programs, the standards, the general health, and the safety topics. Next slide.
So you may be wondering, what are your responsibilities under OSHA as an employer? So here's some things that Cal OSHA requires all employers to do, unless you fall under those specialized, you're only staffed by federal workers, or you're only staffed by your family. Employers must provide their employees with work in workplaces that are safe and healthy. They must correct any hazardous conditions that they know might result in serious injury. They must comply with all applicable Cal OSHA standards, including training requirements. They must be able to notify the nearest Cal OSHA office within 8 hours of any serious injury or fatality that occurs on the job or serious illness caused by the job. Any inpatient hospitalization of 3 or more employees as a result of a work-related incident must also be reported right away. They must also, you as an employer are required to display Cal OSHA's safety and health protection on the job poster. And we do have a link down here for where you can find and download the poster, English and Spanish. Nina?
All right. So what are employee responsibilities under Cal and OSHA? So your responsibility as an employee is to first follow all safety rules and instructions. So oftentimes the employers will have these posted all around their buildings. So it is your responsibility to read them, follow them, and know them. You are also to use safety equipment and protective clothing when needed. You are to look out for the health and safety of your coworkers. Remember, there's no I in team. And you are to also keep work areas clean and neat. Know what to do in an emergency. If your organization doesn't have a risk management guide or a plan, try to come up with one in a team meeting. Talk about, the emergency routes, what you should do if XYZ or ZZ happen. You always want to plan for every single letter in that alphabet. And report any health and safety hazards to your employer. Next slide.
How can Cal, so this is a lot, right? Like there's a lot of information to take in, a lot to know and understand here. This really is just kind of an overview of some of the concepts, but you can get help directly from Cal OSHA about what is required of you. Cal OSHA has a consultation service that provides technical assistance to employers on health and safety problems. The consulting services include a free on-site visit, assistance in complying with Cal OSHA standards, educational seminars, and publications. Although primarily a service for employers, the consultation service is also available to workers. So if you're an employee and you think that your organization needs some help meeting Cal OSHA standards, you can also contact Cal OSHA for these free services. The consultation service can give employers information on how to improve workplace injury and illness prevention programs. We have a link directly to the consultation service. And we have provided some additional resources for all the information we presented today. You can find out more at the links provided here on our additional resources slide. This webinar is being recorded. We do have the transcription service on, so all notes are being physically recorded, all the narrative that goes along with the slides. We will have the slides, the webinar, all of this available on our website. And we are now at questions and answers.
There isn't anything in the chat, but if anyone does have a question, you are more than welcome to come off mute. But if you don't, that's completely fine as well.
Can you go back to the previous slide with the contact information?
Sure. And again, we'll make like, you can take a picture of this if you want to, but it will be available on our website. So you will be able to get a copy of this.
Yes, the slides and the recording will be up soon, within 1 week. And that is, I believe, it. There are no questions. Today was a short one, packed with a lot of information, but we do want to thank everyone for joining us today. Next week, there is a holiday. It is 4th of July. Yay! However, we will still have a Wednesday webinar. It will be more of a meet and mingle. So if you want to come, attend, mingle with the other grantees that have received the CFCI grant and want to chat, maybe connect and network, feel free to jump on. We will be here with some interesting icebreaker questions for all of you, and we hope that it will be very fun. There is one question: will HIPAA forms be given to us for employees, or do we have to create our own HIPAA form?
If you are a JCOD CFCI grantee and you need help with policies and procedures, such as HIPAA policies and procedures, you can work with your grant advocate. We do have some sample policies and procedures. I think I want to specify that next week's, this week's webinar was open to anyone. Next week's webinar is a closed webinar just for JCOD CFCI grantees. I just wanted to be clear about that. But yeah, if you need help with any kind of policy and procedure, such as, writing down your HIPAA policies and procedures, just so you have them on file, these are your procedures, you can work with your grant advocate to develop those.
And next week's is not mandatory. All of these, unless otherwise specified, none of these webinars are mandatory. And when one is, we definitely do send out that communication via email, and your grant advocate will also be letting you know that it is mandatory.
Yeah, you should have plenty of time to plan. So, well, all right. Thank you everyone so much. Maybe we'll see some of you back here next week. Have a great holiday. It's California. What is it? It's National Health and Safety Month. June is National Health and Safety Month, as well as Pride. So stay safe out there. Stay healthy.
Have a great day, everyone. Goodbye.
Bye.